Let's talk about cruciates. So many dogs are having cruciates. Cruciate injuries. Do you realize that 80% of orthopedic surgeries are on cruciates? The dogs are tearing them left and right. It has literally doubled in the last 20 years. So let me explain to you what we're talking about. Here's the hock or ankle, here's the knee, here's the hip. Inside, we have our tibia, we have our femur, we have our fibula, the little bone that sits right there, and we have our patella, our kneecap right there. That's a lot to have hold together. And the dogs twist and turn, and there's all kinds of things that can go on. So there's cruciate means cross. There's ligaments, so go from bone to bone, that hold things in place. And the cranial cruciate, meaning the front, as compared to the caudal cruciate, is very, very easy to tear in dogs nowadays. So it prevents the tibia from going forward in the knee, and it prevents rotation. So what happens is the dog tears their cranial cruciate ligament, and there's instability, and then we get lots and lots of arthritis. We don't want to see that. There's lots and lots of pain. Beyond that, 50 to 60% of dogs that tear one cruciate have a chance of tearing the other one within the next 2 years. We don't want that to happen. I want to tell you a secret on why I think that we have so many problems and what we can do to fix it. Now, I've been doing this for a long time, and what I have found is that when dogs have cruciate injury, with or without surgery, they lose the ability to flex and extend their knee. When they lose the ability to flex and extend their knee, they also lose the ability to flex or bend their tarsal joint or hock joint. Why is that important? Well, one of our tests is that if we keep the knee steady and we bend the tarsal joint or hock joint, that tibia comes forward. So even if we do a surgery like a TTA or a TPLO, that doesn't stop that tibia from coming forward. So the dog goes to sit, and that pushes that tibia forward, and it hurts. So they say, I'm not going to put weight on that leg. I'm going to put it out to the side. I may put it out back. I may put it forward. I'm going to shift my weight onto my other hip, and I'm not going to bend my hock joint or tarsal joint more than 90 degrees. Oh, that's so much more comfortable. But if they don't have equal weight on their feet, when they go to stand up, if their weight shifted, every time they get up, 90% of their weight is on the other side. And what does that do? The dog has some rotation in there. It causes inflammation in that joint. And I truly believe that that significantly increases the chance that they're going to tear the other side. So what can we do to prevent that? If your dog has a cruciate injury previously or recently, we want to make sure that we can bend our hock joint normal, right? That's a normal angle, so that we can have the dog sit square and get up balanced so that we don't have problems in the other knee. And we want to make sure they can bend their knee and extend their knee all the way. They actually lose extension more than flexion, right? And that, by not being able to extend, changes their whole gait pattern, right? They may have a shorter stride because they can't come to here. They can only come to here. And that is also going to shift weight to the other side. We don't want to see that. We want them to have normal range of motion, be able to get up normally, and prevent any other injury on the other side.